Hi, everybody. This is Dr. Britt Talley Daniel, MD. I'm a neurologist and a headache doctor, and today I'm talking about an external trigeminal nerve stimulation apparatus called Cefaly, C-E-F-A-L-Y. All right, so migraine is a genetically inherited neurobiological illness consisting of moderate to severe, one-sided throbbing headaches that come with sensitivity to light and noise, and nausea and vomiting. Migraine is very disabling and occurs more frequently and severely in women, where it relates to estrogen, and less often in men, about 6%. The occurrence of migraine attacks may be migraine without aura, as described above, or migraine with aura, which comes with a headache plus the visual appearance of spots, holes, seeing half of things, or seeing luminous zigzag lines, which usually appear before the headache starts. Migraine is classified according to the International Classification of Headache Disorders as episodic migraine, which is less than 15 migraine headache days a week, or chronic migraine, which is 15 or more headache days a week, 8 of which have migraine features. So what is external trigeminal nerve stimulation, Cefaly? Cefaly is an electronic device that provides neurostimulation by attaching an electrode to the forehead and sending out pulses to the upper branch of the trigeminal nerve. It's an external trigeminal nerve stimulator. It's called ETNS. It's approved by the FDA under prescription for the prevention of migraine attacks or for acute therapy of a migraine with or without aura type of attack. Cefaly can significantly reduce medication use and improve the quality of life for migraine patients. The device came out in 2008 and has been reviewed favorably for effectiveness and safety by multiple medical journals. Related questions. How is Cefaly used? The device can stop a migraine process and prevent future episodes also. This electronic medical device can provide migraine treatment without the use of medication. It can also help persons with migraine and overtreatment, which causes medication overuse headache. Cefaly technology addresses the different phases of migraines, and there are 3 treatment options. Cefaly Prevent, which is a prophylaxis treatment, Cefaly Acute, which is a rescue treatment, and Cefaly Dual, a device that combines both prevent and acute technology. Dr. Pierre Reggio, the chief executive officer of Cefaly Technology and a member of the team that invented the device, said, quote, "We've developed a way for migraine patients to stop a migraine and prevent a migraine without medication and with next to no side effects," end of quote. How is Cefaly administered? The device is placed on the forehead via a magnetic connection to a self-adhesive electrode, which then sends precise micro-impulses through the skin to the upper branches of the trigeminal nerve to either relieve headache pain during a migraine attack or to prevent a future migraine attack. Cefaly Acute setting would be used during a migraine attack. The patient would use this setting for a 1-hour session during the migraine to stop the attack and relieve the headache pain. Cefaly Prevent setting provides migraine prevention, and it's designed to be used 20 minutes per day by people experiencing migraine symptoms 3 or more times a month. This setting changes the trigger threshold of the migraine to reduce the frequency of migraine days. And on my webpage, www.drmigraine.com, I have pictures of this if you want to see it, plus an article. How is neurostimulation performed? Neurostimulation was applied via the ETNS Cefaly device for a 1-hour session. The device is a constant current generator for a maximum skin impedance of 2.2 kiloohm that delivers rectangular biphasic symmetrical pulses with a 0 electrical mean. The pulse frequency used in the current study for the Verum device, that means the real device, is 100 hertz, and the pulse width is 250 microseconds. The total maximum dose of current delivered by a 1-hour session is 2.84. The intensity increases linearly to reach a maximum of 16 milliamps after 14 minutes, and then remains constant for 46 minutes. The electrical pulses are transmitted transcutaneously via a supraorbital bipolar self-adhesive electrode. which is 30 by 94 millimeters. It's placed on the forehead, designed to cover and excite and trigger action potentials of the supratrochlearis and supraorbitalis nerves bilaterally. Those are branches of the trigeminal nerve. What are the results of using Cefaly? The new FDA approval follows several clinical trials that demonstrated that 1 hour of ETNS with the Cefaly Acute can relieve or stop a migraine headache. Results from the acute treatment of migraine with external trigeminal nerve stimulation double-blind randomized placebo-controlled trial were presented at a recent meeting of the International Headache Society. The findings showed that on the average, the Cefaly treatment reduced migraine pain by 65%. In addition, 32% of patients were pain-free within an hour. What is the clinical effectiveness of using Cefaly? Neurostimulation of the trigeminal nerve with Cefaly produces a sedative effect. Regular repetition of this sedative effect helps reduce the number of attacks of migraine. 2 studies involving 87 patients looked at how well the procedure works and showed the following benefits after 3 months of treatment with the device. There were fewer days with migraine, fewer migraine attacks each month, fewer days each month with any headache, less severe headaches, fewer migraine drugs needed each month, and most patients were very or moderately satisfied. What are the side effects of Cefaly? The side effects were not serious and were seen in a small number of patients. Side effects were minor and reversal events in 4% of patients. They gave no further details of what that meant. Local pain or intolerance of paresthesia and a pins and needles feeling caused by the device in 2% of patients. Skin problems in less than 1% of patients, including temporary local skin allergy, forehead skin irritation, and a feeling of bruising on the forehead. Arousal changes, mostly sleepiness, fatigue, sometimes insomnia. 19 patients had headache after the stimulation. How does Cefaly compare with pharmacological treatment of migraine? Current available acute migraine treatments are mainly pharmacologic therapies, using analgesics, non-steroidal anti-inflammatory drugs, NSAIDs, and migraine-specific drugs such as ergots and triptans, and we now have one GPANT and one Ditin, DITIN, for acute therapy of migraine. These drugs have incomplete efficacy as well as side effects and contraindications. Overdose of drugs for treating migraine may also lead to medication-induced headache and chronification of migraine. Unfortunately, there are no reported studies currently comparing pharmacological treatment with the use of Cefaly. These limitations highlight the need for non-pharmacological options for acute migraine treatment, such as Cefaly provides. What do studies on the use of Cefaly for acute migraine treatment show? Chow et al. wrote in Neuromodulation in 2017 on external trigeminal stimulation for the acute treatment of migraine, an open-label trial on safety and efficacy. The authors assessed the safety and efficacy of external trigeminal nerve stimulation via transcutaneous supraorbital stimulator as an acute treatment for migraine attacks. This was a prospective open-label clinical trial conducted at the Columbia University Headache Center in New York. 30 patients who were experiencing an acute migraine attack with or without aura were treated with a 1-hour session of ETNS, which is Cefaly, at the clinic. Pain intensity was scored using a visual analog scale before the treatment, after the 1-hour treatment session, and at 2 hours after treatment initiation. Rescue medication intake was recorded at 2 and 24 hours. The results: 30 patients were included in the intention to treat analysis. Mean pain intensity was significantly reduced by 57.1% after the 1-hour ETNS treatment and by 52.8% at 2 hours. No patients took rescue medicine within the 2-hour observation phase. Within the 24-hour follow-up, 34.6% of patients used a rescue medication. No adverse events or subjective complaints were reported. Conclusions: the findings from this open-labeled study suggest that transcutaneous supraorbital neurostimulation may be a safe an effective acute treatment for migraine attacks and merits further study with a double-blind, randomized, sham control trial. What do studies on using Cefaly for migraine prevention show? Paolo De Fiore et al. Wrote in Neurological Sciences in 2017 on transcutaneous supraorbital neurostimulation for the prevention of chronic migraine, a prospective open-label preliminary trial. The abstract from that study follows. Since chronic migraine is difficult to treat and often associated with medication overuse, non-invasive neurostimulation approaches are worth investigating. Transcutaneous supraorbital stimulation using the Cefaly device is promising as a non-invasive preventive treatment for episodic migraine, but no data are available for chronic migraine. Our aim was to perform a preliminary evaluation of the efficacy of the Cefaly device for the prophylaxis of chronic migraine with or without medication overuse headache. Primary endpoints were 50% reduction in monthly migraine days and 50% reduction in monthly medication use over 4 months. In an open-label study, 23 consecutive headache center patients with chronic migraine, diagnosed according to the International Headache Society criteria, were recruited prospectively. After informed consent, patients were trained to use Cefaly and instructed to use it for 20 minutes daily over 4 months. All patients received active neurostimulation. 35% of the patients enrolled in the study achieved the study endpoints. Over half the patients had a greater than 50% reduction in acute medication consumption. Well, how does one contact Cefaly for more information? For more information, visit http://www.cefaly.us. Find Cefaly on Twitter at Cefaly and on Facebook at www.facebook.com/CefalyEN. So this is the end of my comments on external trigeminal nerve stimulation with Cefaly. God bless all you people who have migraine. I hope this is helpful for you. Please follow me on Podbean for other comments on migraine. And also you could see my migraine blog at www.drmigraine.com. I will see you all on the next talk.